I think we can start. Welcome to the pharmacology class, and today's lecture is cholinergic agonists. So today we are starting a new part of the pharmacology. It is autonomic nervous system, and we are starting to describe the drugs. So previously we mostly studied the basic pharmacology, a general pharmacology, and now we will talk in detail about the medicines. So that is why please pay attention. And drugs that act on autonomous nervous system can be divided to cholinergic and adrenergic. Adrenergic drugs will act on cholinergic receptors and will on the same receptors that acetylcholine will act, and adrenergic drugs will act on adrenergic receptors, and that is the same receptors that epinephrine and norepinephrine will act. And every of that class has a limited clinical effectiveness. However, we are starting from the most basic drugs, so that is why pay attention to that. And cholinergic drugs will act on the postganglionic neurons that are located in parasympathetic nervous system, and this is actually acetylcholine is a neurotransmitter and the receptor is a muscarinic receptor. So the acetylcholine is synthesized in the nerve ending from the choline by the enzyme that is acetyltransferase, and it uses choline and the acetylcholine A as the to make acetylcholine. Then the newly synthesized acetylcholine will taken to the storage vesicles and is kept in these vesicles until the excitation of the nerve, and then when the release is activated by the inward calcium, then the release will make the acetylcholine to go in the synaptic cleft, and then the neurotransmitter acetylcholine can act on the presynaptic receptor or postsynaptic receptors, and this stage is mostly blocked by the cholinergic antagonists, and then the acetylcholine will be degraded by the acetylcholine esterase to the choline and acetate. Acetate will go to the blood, and the choline will be recycled by the nerve. And actually on every of these stages there are drugs that will inhibit every of this stage, but most drugs will act on the receptor and will block or activate the cholinergic receptor. There are two types of the cholinergic receptor. First is a muscarinic receptor and the second is nicotinic. So muscarinic receptor will be activated by the muscarine that is obtained from the mushroom, and the acetylcholine will also activated by the nicotine that is obtained from the tobacco will not activate this receptor. And vice versa, the nicotinic receptor will be activated by the nicotine and also acetylcholine, but will not be activated by the muscarine. So these are two types of the receptors and the difference in the receptors. The receptors, so the drugs are divided to the direct acting and indirect acting. And direct acting drugs include the acetylcholine and pilocarpine, and also nicotine is the nicotine is not a drug itself, but it can be found in the tobacco smoke. And then carbachol and beta-nicole are used in the experimental pharmacology, and some of them, like beta-nicole, are used in clinical practice too. So, and then this on direct acting agonist and indirect acting agonist will inhibit the enzyme acetylcholine esterase that decreases the acetylcholine concentration in the synaptic layer, by that indirectly activating the cholinergic receptors. And the acetylcholine esterase will act on this bond, this is ester bond, and the acetyl group will be removed, and that will deactivate the acetylcholine as well as beta-nicole and also carbachol. Still, the esters of the carbamic acid are more resistant to the hydrolysis by the acetylcholine esterase, but they are still can be degraded. Pilocarpine is more stable to the acetylcholine esterase, and because there is no the ester bond here, and that's why it's more duration of action is much higher. Cholinergic agonists mimic the effects of the acetylcholine by binding directly to the cholinergic receptors, nicotinic or muscarinic. So this direct acting agonist, and they are divided into two groups. First group is endogenous choline esters, which include acetylcholine and carbachol and beta-nicole. So acetylcholine, carbachol and beta-nicole. And the second group is naturally occurring alkaloids such as nicotine and pilocarpine. So nicotine So nicotine is the alkaloid of the tobacco, and pilocarpine is alkaloid of many uh, many uh, many herbs, the uh, plants for the um, that drugs can be obtained from. So the direct acting cholinergic drugs have a longer duration of action than the acetylcholine, like beta-nicole and carbachol, and uh, pilocarpine and beta-nicole are most therapeutically useful because pilocarpine is selective M selective M cholinergic, and the pilocarpine is used in the ophthalmology and beta-nicole is used in the urology. So, but besides that, the clinical application of the cholinergic agonist is not broad. So, and the acetylcholine uh, is a quaternary ammonium compound that cannot penetrate the membrane, uh, and it is a neurotransmitter of the parasympathetic and somatic nerves, and it lacks the therapeutic importance because it's rapidly inactivated by the choline esterases. Acetylcholine has both muscarinic and nicotinic activity, and the actions of the acetylcholine include the action on the heart rate, and the acetylcholine act as the parasympathetic nervous system activation with the vagal nerve, and uh, the cardiac rate is reduced by the acetylcholine, and the acetylcholine also will lower the blood pressure by the activating M3 receptors on the endothelial cells of the blood vessels. And the activation of these receptors will produce the nitric oxide that is very potent uh, vasorelaxing factor, and then lead to the vasorelaxation. Also, acetylcholine increases the saliva secretion and stimulates the secretions in the intestine, also the motility of the intestine, and also it enhances the secretion of the bronchi. And also acetylcholine will relax the muscle of the uh, urinary bladder neck, and that will lead to the urination. In the eye, acetylcholine will lead to the stimulation of the ciliary muscle that will lead to the near vision and also will lead to the constriction of the pupils, causing meiosis. So this effect is sometimes used for during the ophthalmic surgery. So the second drug is beta-Nicole, and beta-Nicole is uh, an ester, and it has a common structure with the acetylcholine, and it's not hydrolyzed by the acetylcholine esterase because of the carbamic protection, and it only acts on the muscarinic receptor. It will not act on the nicotinic receptor, and the beta-Nicole directly stimulates the muscarinic receptors, causing increased intestinal motility and tone, and it also stimulates the detrusor muscle of the bladder and activates the urination. So the beta-Nicole is used in urology to stimulate the atonic bladder, that is the urinary pregnancy, and usually is used postpartum or post-operative. So postpartum actually for the after the delivery of the baby, and post-operative is mostly on the operations on the urinary bladder or any other operation around. Uh, uh, Also, the beta-Nicole has adverse effects that include the sweating, salivation, so sweating, like this is diaphoresis, uh, salivation, and also the nausea, uh, urinary urgency, uh, diarrhea, and bronchospasm in the patients with the with an asthma. Also, meiosis is a diagnostic factor, and the abdominal pain can also be reported, as well as flushing. Flushing is the red face actually. To overcome the cardiovascular and bronchoconstrictor response, the atropine can be administered to treat uh, the cardiovascular bradycardia or the bronchoconstrictor in the asthmatic patients. So the next is carbachol and carbacholine or carbachol. It has both muscarinic and nicotinic actions, and carbachol is the ester of the carbamic acid, and so uh, this is carbamic acid and this is the ethyl ester. So the and that is why it's also is not hydrolyzed by the acetylcholine esterase, and that is why long duration of action. The carbachol has a profound effect on cardiovascular and GI because it stimulates the uh, ganglion activity and may lead to the release of epinephrine from the adrenal medulla because of the nicotinic action, and it also will lead to the meiosis and spasm of accommodation when instilled to the eye, uh, and also leads to the meiosis. The Because of the high potency and non-selectivity, carbachol is not used in the clinics, only in ophthalmology for treating the glaucoma. Uh, because the pupil contraction will lead to the decrease in the intraocular pressure. Adverse effects include no side effects when used when it's still to the eye, because it's not penetrate to the blood through the eye, and it's not used systemically. The next one is the pilocarpine. Pilocarpine is the alkaloid and is uh, tertiary amine that is stable to hydrolysis, and it's less potent but can penetrate to the central nervous system, and also it is a muscarinic agonist and mostly used in ophthalmology for treatment of the glaucoma, as well as for the emergency treatment and for the chronic treatment as well. Because when applied to the eye, pilocarpine produces the rapid meiosis and contraction of the ciliary muscle, and then when eye undergoes meiosis, it leads to the spasm of accumulation. The vision becomes fixed at some particular distance, making it impossible to focus. And pilocarpine is one of the most potent stimulators of secretions such as sweat, taste, and saliva, uh, but it's usually not used for that purposes. Uh, the drug is used for the salivation in patients with xerostomia uh, that can be resulted from the irradiation of the head and neck. Sjogren's syndrome, which is characterized by the dry mouth and lack of teeth, is also treated by the pilocarpine orally with the tablets or with the 7-meline. Uh, 7-meline is also actually non-specific, so that is why many adverse effects. In glaucoma, pilocarpine is used as a drug of choice for emergency, for lowering the intraocular pressure, and is effective in both open angle and closed angle glaucoma. And pilocarpine is extremely effective in opening the trabecular meshwork around the Schlemm's channel, causing an immediate drop in intraocular pressure as a result of the increased drainage of aqueous humor. This action occurs within a few minutes and lasts for up to 8 hours and can be repeated. Adverse effects include the blurred vision, night blindness, and brow edge. Poisoning with pilocarpine is characterized by disaggregation of various parasympathetic effects, including refuse sweating, diaphoresis, and salivation. So diaphoresis and salivation uh, can be seen in patients with overdose of pilocarpine. Uh, and the effect is almost the same as produced with the mushroom poisoning. The mushrooms of enopsygen are poisonous, so actually the same muscarinic uh, poison is located in the mushrooms. Uh, the treatment is with the atropine, the same as for the beta-Nicole. So the next group is indirect acting cholinergic agonists, and the acetylcholine esterase. So there is enzyme in the synaptic cleft that is called acetylcholine esterase, and it destroys the acetylcholine to acetate and choline. So this enzyme is blocked uh, by the acetylcholine esterase inhibitors, uh, and that lead to the action of the acetylcholine. The action is prolonged, and that is why the receptor is activated, and there is same effect as if we introduce a cholinergic agonist. So these drugs are non-selective, so they act on both nicotinic and muscarinic receptors, and also they act in the brain and also at the neuromuscular junctions. The reversible acetylcholine esterase inhibitors are classified into short-acting and intermediate-acting. So the Androphonium is one of the first short-acting acetylcholine esterase inhibitors, and it binds reversibly to the active center of the acetylcholine esterase, preventing the hydrolysis of the acetylcholine. It's absorbed rapidly, and duration of action is up to 20 minutes, and the Androphonium is a quaternary amine, and it acts on periphery. It is used in the diagnosis of myasthenia gravis, and that is an autoimmune disease caused by antibodies to the nicotinic receptor at the neuromuscular junction. This causes the degradation of the neurons and the receptors of the nicotinic receptor, making the receptors unavailable for interaction with acetylcholine. The injection of androphonium leads to the rapid increase in muscle strength, and androphonium may also be used to access the cholinesterase inhibitor therapy for differentiating cholinergic and myasthenic crisis, and also for reversing the effects of non-depolarizing neuromuscular junctions after the surgery. We will speak about the neuromuscular blockers later. However, the Androphonium is used seldom now because there are more effective and long duration drugs like Physio Stigma. Physio Stigma is a nitrogenous carbamic acid ester found naturally in plants and is a tertiary amine. It is a substance for the acetylcholine esterase, and it is formed stable uh, carbohydrate intermediate with the enzyme, which then becomes irreversibly inactivated. Uh, that leads to the potentiation of the cholinergic activity. Physostigmine has a wide range of effects and its duration is about 30 minutes and can last up to 2 hours, and it is considered intermediate active. The physostigmine increases the intestinal and bladder motility, and these are used in atony of the intestine and bladder. Physostigmine is also used in the treatment of overdoses of the anticholinergic drugs such as atropine. So, for example, in children that eat the berries, uh, the wolfberries are in woods and can be overdosed by the atropine that can be found in those berries, wolfberries. Adverse effects include the convulsions and then bradycardia and decrease in heart output, and also can lead to the paralysis of skeletal muscle, but only in higher doses. So the adverse effects include bradycardia, that is lazy heart, hypotension, meiosis, and contraction of the smooth muscles of the intestine, GI. So this was a physiostigmine, and then neostigmine is also a synthetic. It is also a carbamic acid ester. Reversibly inhibits acetylcholine esterase and is very similar to the physostigmine, but neostigmine is a quaternary nitrogen, and it's more polar and absorbed fully from the GI, and it will not enter the central nervous system. That is why it will act more on skeletal muscle and will stimulate the contractility and then will lead to the paralysis. The duration is actually the same as physostigmine, is intermediate up to 2 hours, and is used as antidote for neuromuscular blockers, and also used to stimulate the bladder and GI. Sometimes neostigmine is used to treat the neostigmine drugs. So adverse effects are the same as for the physostigmine, and it's contraindicated in patients with urinary bladder or intestinal obstruction. Pyridostigmine and ambinonium are the used for the treatment of the myasthenia gravis, and they are long duration of action and can be up to 6 or 8 hours. So same adverse effects. And the The longest duration of action are seen for tacrine, donepezil, rivastigmine, and galantamine. These are used for the Alzheimer's disease treatment. So the tacrine was first of these drugs, uh, but it has a hepatotoxicity, and the later drugs, the rivastigmine, galantamine, and donazepam, are used for the treatment of Alzheimer's disease, and they reduce the symptoms and can delay the progression of the disease. So adverse effects are actually the same, but mostly act on GI. And also, there are irreversible indirect acting cholinergic agonists. These include echothiophate. Echothiophate is an organophosphate that has its phosphate group covalently binding to the enzyme, and after that the acetylcholine esterase is permanently inactivated, and the restoration of activity requires synthesis of a new enzyme. The actions of echothiophate include the stimulation of the cholinergic activity, including the paralysis of motor function, like difficulties in breath and convulsions. And echothiophate reduces intense meiosis, and that leads to the decrease in the intraocular pressure. Used as a topical ophthalmic solution for the treatment of the open angle glaucoma. But the echotape effect can lead to the cataract. That is why its usefulness is limited. So the reactivities of the choline esterase include the pralidoxime, and pralidoxime can be used for the treatment of the overdose of the acetylcholine esterase inhibitors, or the direct acting. So only the acetylcholine esterase enzyme inhibitors, but it's only effective for the reversible. So that is all for today, and thank you for your attention. Any questions?